everyone, this is Das and welcome to my channel Nutriness. In today's video, I'm going to talk about one of the most important topic which most of the women in these days suffer. That is PCOD or PCOS. PCOD or PCOS stands for Polycystic Ovarian Disorder or Polycystic Ovarian Syndrome. Both are one and the same. You can either call it PCOS or PCOD. Now, as the September month has started, September month is PCOD awareness month. So this video is mainly about PCOD. Everything with what you want to know about PCOD is right in this video. Now I'm going to also post upcoming 2 videos which will be like a series of videos, 3 videos talking everything about PCOD. It's just because I cannot cover everything about PCOD in just one video. That's the reason I have segregated the different topics about PCOD in my 3 videos. Now in this video we are going to talk about symptoms of PCOD, the causes, the root causes of PCOD, and what is actual PCOD. Okay, now 50% of the women in India stays undiagnosed. Even if they carry PCOD, they might not know, they might not be aware of it. And PCOD, 50% of women might have the risk of getting diabetes, obesity and high blood pressure just because of carrying PCOD. Now, what are the symptoms of PCOD? Now, the first symptom of PCOD is problem in your periods. We all know that periods, we might know that one of the major factor for PCOD, one of the major symptom for PCOD might just be periods, but it's not that. There are many other symptoms as well. But one of the most important symptom is, yes, irregularity in periods. Your periods might be delayed, or your periods might be irregular. Your periods might occur early, or even it might take a long time. It might be prolonged. So this is one of the symptom of PCOD. And if you are having this symptom, or if you cannot track your periods regularly, then I insist that please visit a gynecologist. Do not delay. Do not take it light. Okay. Now, number 2 symptom is women gaining weight without any explanation. So PCOD also makes your body to bloat. You might gain a lot of weight without any proper reason, or you might find that it is very difficult for you to lose weight. So this is one of the other symptom of PCOD which women may suffer. Now the third symptom of PCOD is that there is a sign of excess male pattern hormone. Now what is this? Male pattern hormone, that is testosterone, is there in every female body. That's the reason we might get our facial hair or body hair. But the women who carries PCOD, they might have a large amount of this hormone, that is male pattern hormone or testosterone, and due to which they might have a lot of acne on their skin, or they might consist of lot of body hair or facial hair, and that's the reason you are suffering from a lot of facial hair, body hair. It's just because of the excess of this hormone, and this is another symptom for PCOD. Now, next symptom will be infertility. Women who are infertile or who has problem in conceiving a baby, please, I suggest you or insist you to please consult a gynecologist, because you might also suffer from PCOD. That might be one of the cause here. Okay. Now the next symptom here is insomnia, that is trouble falling asleep. You might have a trouble falling asleep even if you are really tired and you want to sleep but you are not able to sleep. That might be one of the symptoms for PCOD. And also there is another symptom, that is snoring. Snoring can also be one of the symptoms for PCOD. And the next symptom is mood changes or mood swings. You might suffer from depression, or you might suffer from anxiety or a lot of stress. So these are common factors. These are the common symptoms of PCOD. So I insist that if females or women out there, if you think that these are certain out of these points, if there is any point which you think that you are suffering from, then I insist you that please do not take it or consider it lightly. I insist you to please visit a gynecologist and get it confirmed that you are perfectly fit, you are perfectly fine, and even if you are diagnosed with PCOD, then I assure you that I will be talking about its treatment and the solution for PCOD so that you will feel better. Okay, but before that, let us get to the next point. So I have written a lot of points so that I do not miss any points, and this will be really beneficial for you. Now there is another criteria which I want to tell you about, is how to diagnose that you have PCOD. So we, or the doctors, usually follow one criteria that is named as Rotterdam criteria. Now under Rotterdam criteria, what they do is they track your periods. If you have irregular period, that might be one of the factor for this criteria. Second is, if there is excess of testosterone or male pattern hormone in your body, then that might be the second criteria. And the third is, they proceed with an ultrasound. Now in this ultrasound, if they find that yes, your ovary is considering, if your ovary consists of this disorder, that is PCOD, then you are diagnosed with PCOD or PCOS. So ultrasound is a must for this diagnosis. Okay, now I'm going to talk about what are the root causes for PCOD. Now number one root cause for PCOD is genetic cause. Yes, if your mother or your grandmother has PCOD, then there is a chance that you might get this disease. So genetics, genetically it might travel from or transfer through your chromosomes or genetically through your genes, and you might get this disease through your genetics or heredity. Next, number two factor is a faulty lifestyle or bad lifestyle. I wouldn't say bad lifestyle, that's a very strong word, so I will tell it as poor lifestyle. Okay, so what is poor lifestyle? Now poor lifestyle is, nowadays most of us, we are neglecting our health just because of our work pressure, or we are working in an MNC company and we might work in rotatory shifts or night shifts. So that causes a disbalance in our night sleep routine, or we travel to our offices and we might not carry our lunch boxes or our dabbas with us, and we often travel outside and we eat a lot of junk food. So these are few factors which might cause PCOD in your body. So faulty diet or faulty lifestyle is another cause for PCOD. So please, I suggest, do not try to disturb your cycle. If you are in your night shift or rotatory shift, or for some reason you're not able to sleep properly, please manage your lifestyle in such a way that you're at least getting an adequate amount of sleep, that is 7 hours to 8 hours of proper sleep. That is necessary for every adult human being. Do not neglect that sleep cycle. Okay, now next is a lot of stress. So stress can be one of the major cause for PCOD. I request you that do not take stress. Even if you're stressed, then please do some meditation, or if there is lack of physical activity in your body, that might also be one of the root causes for PCOD. So mainly faulty lifestyle or poor lifestyle is one of the cause for PCOD. So please avoid those cause and try to maintain a healthy lifestyle. Try to avoid junk or processed food. Now also there is another last point which I would like to tell, is about chronic low grade inflammation, which might be one of the cause as per the latest research. Now what is that? Now this is like nothing but stress response from your body. So if you are stressed, your body releases this inflammation is just because to cope up with that stress. Now if your body is releasing that if you are having a physical stress or mental stress, your body is trying to cope up with that stress. But while it is trying to cope up with that stress, your body is working in itself, and it might internally develop PCOD. Is just because another part of your body is functioning to cope up with that stress, while the other part of your body is internally unknowingly developing PCOD. So do not take any sort of stress. That is one of the major factor for PCOD. So guys, I hope you like this video. This is the everything about what you need to know about the causes and symptoms and a definition of PCOD. In my next video, I will be coming up with the diet in PCOD. If you are suffering from PCOD, what is the main diet you should take? So please wait for my next upcoming video where I will be talking about the diet which you should take if you are having PCOD. Thank you and have a great day. Bye guys.